Radio City presents Ask Marka.
Psychosis is basically the disorder in the way we think and perceive. Anyone suffering from psychosis will have abnormality in the way they think, they perceive what happens within themselves and also how they relate to people and the surroundings. They may have specific symptoms like false beliefs called delusions, false perceptions like hallucinations, or sometimes very disjointed thinking in their mind. So they may have very wrong connections about what's happening around, get very suspicious about people and the environment, and it can be quite distressing for the person. It can be quite scary and threatening, and many times family may not know what to do about it. The other important thing about psychosis is the person may not have insight into their psychiatric condition. So that makes it a little more harder to get them to treatment. So at Marga, we do have specialist teams who can actually go to these people, talk to their families, ease their anxieties, and bring them on board for not just to improve their insight but also for the right treatment. Psychosis can be multifactorial in the nature of its cause, because anyone suffering from psychosis, what we try and do is try and understand why this person is suffering from psychosis. Psychosis can be secondary to some serious mental illnesses like schizophrenia or sometimes bipolar affective disorder, or sometimes it could be just a very transient stress-induced psychosis, or many other psychotic disorders are there. It could be secondary to some organic problem like some physical health problem. So what we do is we try and do a proper extensive assessment of the person to understand what are the causes. Basically, we look at three factors: any biological factors that might be contributing for psychosis, any psychological factors, or any social factors. Many times a lot of predisposing factors could be there, like somebody with a family history of psychosis, like somebody in the family suffering from some psychotic conditions, or the person has gone through some significant trauma or stress during upbringing. Personality factors like any immediate triggers or stresses, all those things can lead to psychotic problems. At Marga, when we do treat people with psychosis or any other serious mental illnesses, there are a lot of unique challenges they pose. First of all, the person with psychosis may have very little insight into their condition. They may also lose the capacity to give consent. So these are some of the challenges. And moreover, a person with psychosis, because of the lack of insight and not being able to have the capacity to consent, they may not even know what to do about it. They may not access the services, and the families may not know what to do about it, and all that. And moreover, the psychosis patients may also start posing risk to themselves or others. Many a times they may pose risk to themselves in terms of self-harm or maybe suicidal, driven by some of the delusions and hallucinations. Or sometimes they may pose risk to others. They may even get violent and aggressive. So people may just look at it as a behavior problem, but it could be secondary to psychosis. And sometimes people with psychosis, even after being treated, because they don't fully believe, they may not comply with the medication and things like that. So these are some of the challenges of psychosis. People with psychosis, like I said, Marga has an extensive team, a multidisciplinary team, who look at this person with psychosis in a very holistic way. What we do initially is, depending on the nature of the problem and at what stage of the illness a person is and what risks they are posing, we decide on how to go about the treatment. Like for example, if somebody is in acute distress because of psychosis, our Marga retrieval team will go any time of the day, 24/7. We can reach out to them and bring the patient to Marga for further assessment and treatment. Or families can reach out to Marga just by contacting our OPD services or emergency services. So the various ways of accessing mental health services. So once we reach out to the patient, once we have the patient in the hospital or in the OPD, we do a very holistic assessment. We try to understand why this person is going through psychosis. We understand the underlying causes. Maybe sometimes we may have to run some tests to rule out any biological causes, talk to the families, understand the person's personality, any personality factors or stress levels they are going through, or social factors and things like that. So once we have the formulation, which means basically understand the nature of the condition and the causes, our treatment approach will also follow similar lines. So we do have biological ways of treating the person, psychological ways, and social factors. Biologically at Marga, we do have medical treatment wherein we give medicines, or sometimes some other biological treatment like ECT, commonly known as shock treatment. That also we use sometimes if it's appropriate. We do take psychological treatment very seriously. Individual psychotherapy or family therapy would also be very helpful. Like I said, the last factor would be social approach. So we do take the individual's personal potential and try and see how we can get the person back to their functioning. So our occupational therapy team will work with the patients and families to get the person back to their functioning, whether you are a student or a working professional. How do we help the person to go back to their original level of functioning? So we do work with families for family therapy if there are any dynamics issues in the family which might be contributing to their psychosis.
Radio City presents Ask Marka.